Use of amoxicillin tablet. Amoxicillin is an antibiotic medication that is commonly used to treat bacterial infections, such as respiratory infections, ear infections, urinary tract infections, and skin infections. It works by preventing the growth and spread of bacteria. Amoxicillin tablets are typically taken orally, either with or without food, depending on the instructions provided by the prescribing doctor or pharmacist. The tablets are usually swallowed whole with a full glass of water. It is important to follow the recommended dosage and duration of treatment as prescribed by the healthcare provider. It is important to note that amoxicillin may not be effective against all types of bacterial infections. It is also important to complete the full course of treatment even if symptoms improve, to prevent the infection from returning or becoming resistant to the antibiotic. Dosage of amoxicillin tablet. The dosage of amoxicillin tablet will depend on the specific infection being treated, as well as the age, weight, and medical history of the patient. It is important to follow the dosage instructions provided by the prescribing doctor or pharmacist. In general, the recommended dosage for adults is 250 to 500 mg taken orally every 8 hours or 500 to 875 mg taken orally every 12 hours, depending on the severity of the infection. The duration of treatment may vary from a few days to several weeks, depending on the type and severity of the infection. For children, the dosage will depend on their weight and age. The pediatric dosage of amoxicillin is typically 20 to 45 mg per kilogram per day, divided into 2 to 3 doses, depending on the severity of the infection. It is important to complete the full course of treatment as prescribed, even if symptoms improve, to ensure that the infection is completely eradicated. Skipping doses or stopping treatment prematurely may lead to the development of antibiotic resistance and a recurrence of the infection. Mechanism of action of amoxicillin tablet. Amoxicillin is a type of antibiotic medication that belongs to the penicillin group. It works by inhibiting the bacterial cell wall synthesis, which ultimately leads to the death of the bacterial cells. Specifically, amoxicillin works by binding to and inhibiting the activity of an enzyme called transpeptidase, which is responsible for cross-linking the peptidoglycan chains in the bacterial cell wall. This inhibition leads to the weakening of the cell wall and the inability of the bacterial cells to maintain their structural integrity. As a result, the bacterial cells are more susceptible to the osmotic pressure of their surroundings and eventually burst, leading to their death. Amoxicillin is effective against a wide range of bacteria, including gram-positive and gram-negative bacteria, as well as some anaerobic bacteria. However, it may not be effective against all types of bacteria, and it is important to use the medication only for bacterial infections and not for viral infections, as it will not be effective against viruses. It is important to use amoxicillin only as prescribed by a healthcare provider and to complete the full course of treatment, as premature discontinuation of the medication may lead to the development of antibiotic resistance and a recurrence of the infection. Side effects of amoxicillin tablet. Like any medication, amoxicillin tablet can cause side effects in some people. Some common side effects may include nausea, vomiting, diarrhea, abdominal pain, skin rash, hives, itching, swelling, particularly of the face, lips, tongue or throat. Difficulty breathing. Less common side effects may include headache, dizziness, insomnia, confusion, yeast infections, vaginal discharge, tongue discoloration or hairy tongue. In rare cases, amoxicillin can cause more serious side effects, such as severe allergic reactions, liver damage, or kidney damage. If you experience any of these more serious side effects, it is important to seek medical attention immediately. It is important to note that not all people will experience side effects from amoxicillin. If you have concerns about side effects or experience any symptoms while taking amoxicillin, it is important to talk to your healthcare provider. Advices for taking amoxicillin tablet. Here are some tips and advice for taking amoxicillin tablet. Take the medication exactly as prescribed by your healthcare provider. Do not take more or less than the recommended dose, and do not stop taking the medication before the full course of treatment is completed. Take amoxicillin with a full glass of water. This will help the medication to be absorbed into your system more effectively. Amoxicillin can be taken with or without food, but if it upsets your stomach, try taking it with food. Do not crush or chew the tablet, as this may alter the effectiveness of the medication. Swallow the tablet whole. Store amoxicillin at room temperature, away from moisture and heat. If you miss a dose, take it as soon as you remember. However, if it is almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not share amoxicillin with anyone else, even if they have similar symptoms. If you experience any severe or unusual side effects, such as severe allergic reactions or difficulty breathing, seek medical attention immediately. Complete the full course of treatment, even if your symptoms improve. Stopping the medication prematurely may result in the return of the infection or the development of antibiotic resistance. Finally, it is important to avoid taking antibiotics unnecessarily. Amoxicillin is only effective against bacterial infections, and it will not be effective against viral infections. Misuse of antibiotics can lead to the development of antibiotic resistance, making it more difficult to treat bacterial infections in the future.